And then you also have an additional filter for response status. So this is just the pre-admission status. There is completed, which the patient has completed their form. You have in progress, the patient is in progress. It's self-explanatory, they're completing that form. You have incomplete, the patient has not started the form. And then you have needs review. Needs review is a status that's used for returning patients. So our system will look for 5 different data points to see if that patient has had a procedure at your facility before. If we find that the patient matches at least 3 out of the 5 of those data points, just to give a couple of examples, there's first name, last name, date of birth, email address. If any of the 3 of those 5 data points match in our system, we will flag that patient as a repeat patient. And we will take the last form that patient completed and copy it over automatically into the new data service form that you're scheduling the patient for. And then that status would show as needs review to tell your staff that this patient is a returning patient and this patient needs to review their previous health history and edit it or give new answers, whichever. But that is the needs review status. And of course you can filter and you can select any of these, or you can just choose to see all the statuses. And you can use all these filters at the same time if you so wish, or you could just choose to use the date filter. That again is completely customizable for you. If you'd like to cancel your filters, you can just click this X and the filters will return to their default state. Over here on your toolbar, you also have print surveys. This is equivalent to batch printing with Simple Admit, very similar. So you can print all the surveys that are available in the queue as of right now. So I would be printing 9 out of 9 forms. Let's go to the queue here. So here you can see quick information about the patient. So you can see the patient's name, their mobile number if you have one at the time of scheduling them, and email address again if you have that at the time of scheduling. We get this information, patient engagement gets this information from case coordination. So case coordination will create the case for the patient and they will pass that on to patient engagement, and we will show that here. Again, you can also see if this patient is a returning patient. You can see the date of service and time for the patient, the physician, consent status. So a big piece of patient engagement is the texting portion, which we will cover in a different live webinar. But consent status is whether or not the patient has consented to receiving text messages. And that is part of the customization your facility can set up as well. So this is indicating that the patient has in fact consented to receiving text messages for your facility.